epidemiologist. He's regarded as the foremost teacher.
Being this far away, what are the problems? We identified a lot of problems and then we were able to solve part of them. So that project is now, it's a very small project that has been completed. Today what we're going to focus upon is some of these, and we're going to spend quite a bit of time on this very major project which has been started quite recently. Years ago when we came together, we started applying jointly for funding. So the International Diabetes Federation, as you know, is the largest diabetes federation in the world. 150 countries are affiliated to that. India is also affiliated to that. So they announced a grant and said that open, we stood first in that application. We were funded, and this project is one of the first projects funded by the International Diabetes Federation under what is called as a Bridges Grant, and this is the DCLIP project, and I'm going to show you. Till now, till about 5 or 10 years ago, all doctors were concentrating only on treatment, not on prevention. People with pre-diabetes, diabetes stage, how much you can do, how much it costs. That means from an experiment, it's not just an experiment anymore. It's become a public health message, and it's going to move to clinical practice. Community ownership. See, all these people who they have said, these are people, they are not patients even. Patients today, they have owned it and they've been empowered. All the material, produced today, that can be freely distributed now. Whoever wants it, we will be able to give that. So they don't have to spend time, money again reproducing the whole thing. They can use that. We can share our results also with them. So what are the positive things, what are the negative things, all that. Finally, we can work with policy makers to extend and expand the program. Some of you may know that in September this year, United Nations is having a special summit, non-communicable diseases prevention, focusing mainly on diabetes and cardiovascular disease. United Nations General Assembly for a special summit
between MDRF, Madras Diabetes Research Foundation, and Emory University. And about two and a half years ago, there was a major opportunity. And this is an organization called Ovations, which is a part of the United Health Group, and the National Heart, Lung and Blood Institute, which is one of the 27, like diabetes, cardiovascular disease, are global problems. Already when you look at it, the country with the most number of cases of diabetes is already India, that you all know. And in the next 20-30 years, that's going to become astronomically high, number one. And secondly, even cardiovascular disease, heart attacks, strokes, the Indian population has a lot of it. And there are projections that in about 20 years' time, 60% of the cardiovascular deaths worldwide will occur in South Asia. They had over 100, 120 or 100 South Asia. And the reason we are calling it South Asia is, like Dr. Bowen explained, the people of South Asia, biologically, culturally, etc., have a lot of common issues. Essentially, when it comes to our genes, when it comes to our lifestyle, diet, etc.
Projects, but if we don't, as Venkat